Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
We all know about emergency medicine, and we hope that we're never in an emergency. But if you are, you want to make sure that the medical personnel there are really good and they really care. So we have Dr. GIOVANNA M UNGARO, who is there at the West Boca Medical Center, which is in Boca Raton, over there on 441. And we welcome you to the show, Dr. Ungaro.
Thank you for having me.
Well, we thank you also for taking care of people in an emergency situation, because sometimes it seems like it's very simple, and then there are other times where it's life and death. And I know that it must be very difficult for you as a physician, because you have to work quickly and you have to work smart.
Yes, true. Very true.
So when you had a choice, is this a specific, when you go to medical school, is this specific that you take emergency medicine, or is this a field that you just get into after you're practicing?
No, actually, it is a residency, a specialty of its own, and it's been since 1970. That's actually when the first residency program was established in Cincinnati. Before that, it was actually like family medicine doctors and internists and even interns and residents of other specialties that would staff the emergency rooms. But they realized that there was a need for actual training in this specialty. And so we've been around for 40, 50 years.
Okay, so in your own profession and your own experience, what has been the worst situation that you have ever encountered?
Every time there's a fatality, a death, it's just tough. Whether, it's a child, that is probably the worst, but even a young adult, an elderly person, because they are leaving family behind. So I say anytime there's an unexpected death, it is tough. It's tough on the family, the staff, and obviously the emergency room doctors. So I think those are just hard. Accidents, biking accidents, motor vehicle crashes, when you end up with someone that you can't resuscitate, those are just tough days. Yes,
and so I know, we only, those of us who don't work in an emergency medicine organization, all we can learn from would be television.
Right.
And so I know it's probably not exactly how it happens. But the other thing is, when there's a lot of trauma, let's say there's been a big explosion, and now there may be 10 people who have to come and be taken care of. How do you manage that?
So we've had drills, actually. I think it was my first month here at West Boca that we had a drill of a mass casualty, and I think it was a rollover school bus. And I think they had this drill where they had all these high school students come, and they would tell you what injury they had. So that's kind of, it prepares everyone. So basically you have to have a quick triage. You have to assess who's life-threatening, who needs immediate care, and who can actually wait. And that has to be done quickly. Obviously, multiple resources are used. We pull people and stuff from everywhere. And sometimes even multiple hospitals are involved. But that we actually practice for all the time.
No, I'm sure that's the worst thing that can happen. But now let's go back into the simple situations. I've heard now that some people should really not go to the hospital, but they should go to these little clinics that can take care of simple situations. And what would you recommend?
Well, there's a huge value in urgent cares. There is. Because a lot of times, if we're busy taking care of the critically ill, we cannot get to the less sick people. So if you have, a small cut or, a cold that's developing, but you're not severely ill, you could probably get seen quickly at the urgent care, quicker than here. We obviously welcome everybody to come in, but sometimes the wait might be a little bit longer, if we're busy taking care of sicker people. There's also, it's just there's more germs here because there's sicker people, and so we don't want you to come in and get sicker too. But the urgent cares are a great asset for the community.
So will an urgent care, it's kind of a silly question, but if you go to an urgent care, they would know immediately if you should be going to the emergency center. They
usually do. They realize if it's beyond their capability, they want to make sure that, a headache's not more than just a headache, God forbid a mass or a bleed in your brain. They refer you to be better assessed at a place that could scan you. Doesn't mean you have to come in and get scanned, but at least you can come and get assessed. And if it is determined that you need a CAT scan or MRI, then the ER doctor has that capability. In the urgent cares, I don't think they have, CAT scans and MRIs and all that stuff, but they should have, staff there that's skilled enough to realize when it's beyond their scope.
So if someone comes in with a broken bone or something serious, then you find the specialist to get them with?
Yes. This hospital in general, but most hospitals have a referral list. This hospital is excellent at having a pretty complete referral list. And a lot of them are very readily available. And during, working hours, they're very easy, to get a hold of and even come in. But basically, from ear, nose, throat, orthopedics, cardiovascular, neurology, all the specialties are just a phone call away from me.
But it really takes a lot of diagnostic work, doesn't it, for you to know really what you have to do?
It does. What we're very good at is making sure that it's not emergent, that it's not life-threatening. We're very good at that. Sometimes we can't get to that elusive diagnosis that even family doctors can't get to on a first visit. But we want to make sure that you're okay, that you're going to be okay, and you can follow up with your doctor.
Exactly. And I guess the other part about this is when someone's in an emergency situation and you ask them questions, sometimes they can't even answer. So you want to know what medications they're on or who, and they won't tell you the truth because they don't know or they don't remember.
That's true. Thank goodness for computers that there is some sort of database now that we are linked to pharmacies, and we can access. And as long as these their medications are updated by their family doctor, we can quickly see what the patient's in. And yes, sometimes people come in because they have what we call an altered mental status. They're unresponsive. They're not with it. They're confused. But sometimes we're able to get a lot of information.
Yes, that's what I was thinking about. I didn't know that you could do that. So you would put their name in, or if they tell you the doctor's name, and of course they don't still, some of them they wouldn't even remember all the doctors they go to.
Right. Sometimes they don't. We have West Boca. Actually, we have some patients that, come here more than once, and we're quickly able to look at their old records and, populate the new forms. But now CVS, Walgreens, all the other pharmacies, Walmart, Publix, they all are linked to us, and we're able to look up patients' medicines. Once we have a list of medicines, we can kind of deduce what medical problems they have.
So I just want everyone to know that my guest, it's really very interesting that we can talk with someone. I don't know if you're working right. I guess I don't know if you're working right now or not, but it's very important that you've taken the time to do this with us. So we just want to make sure that everybody knows we're talking to Dr. Giovanna
Ungaro.
Yes,
You're
Ungaro.
very close,
Dr. Giovanna Ungaro, and she's assistant ER medical director at West Boca Medical Center. And, of course, we've taken her out of what she's doing, and hopefully there's no emergency that she has to go to. But
I start shift at 2. There's a doctor in there. Don't worry.
Okay. So let's talk about children. So when little children come in, and sometimes you hear them screaming, that must be very hard on you. How do you get them quiet so you can even concentrate?
I know. That is tough. And I have kids of my own, so I always feel for it too. But it is tough sometimes. But a lot of times they're screaming. When you realize they're screaming just because the doctor's listening to their lungs, that the pediatric doctor's just listening to their lungs, and they're really just screaming for that reason. Sometimes they're screaming because they're getting an IV, and sometimes they're screaming because they're getting a cut, a laceration, sutured. But it's tough because you never know why they're screaming about. But there's someone taking care of that child, and it's for their benefit. But
yes.
It's tough.
Right. It's very disconcerting. I've been in emergency rooms where, why don't they take care of that child?
Oh, they probably are. The kid's just very, very scared.
Right. So now something you briefly mentioned, and it is true that we all hear about people who go to hospitals and they wind up getting infection. I know that you are, especially at West Boca, you're very careful about infection, but I guess there's only so much you can do.
There is. I mean, there's lots of rules and protocols and inspections just to make sure that we're doing everything in our capability to avoid the spread of germs and bacteria. But it doesn't take much but a cough, from someone that's sick and just for some reason, spreading. But as much as we try, especially those patients that are weak, it's tough. I wouldn't recommend. I wouldn't want a patient to be admitted unless they totally had to be admitted.
Okay, and now let's say someone comes in, and can the family be in there with them, or do they have to wait outside? What are your rules on that?
We allow 2 guests. Sometimes if the patient's undergoing a procedure, we ask them to step outside, or if I'm really dealing with a life and death situation, I ask them to wait outside. But usually, if we're just waiting for labs to come back or a CAT scan to come back, that we allow family to be at bedside.
Yeah, I think, and I agree, and I hope that is the way that you do it, because sometimes it does make the patient feel so much better, doesn't it? If they know that someone's there.
Yeah. Mm-hmm.
And how about dogs?
I gotta say, in the last year or so, I've seen a trend of some what we call, service dogs, but they have to be service dogs. There are some people that they're not certified as service dogs, and they bring them in, and I don't think other patients would appreciate it. So we got to make sure they're service dogs, either for seizures or whatever it may be. But as long as they're medical reason, that's okay.
Yeah, because people are. That's right. They need to do this. So let's just go over some of this as an emergency doctor. What have you learned in this capacity as compared to a regular, an internist? What would you say is different for what you do?
Well, I think an internist does know a little bit about everything, and they learn to maintain the health of the patient. We are addressing, 1 or 2 problems at a time, and we, like I said earlier, we want to rule out a life-threatening issue. So if someone comes in with chest pain, we want to rule out a heart attack, or if that's not it, then, So, and then we have to make the decision, does this patient go home? Does the patient get admitted? Does the patient need an immediate intervention? And we also have the capability to get tests right away, which the internist doesn't. So I think if you're feeling too ill and your doctor can't see you, this is definitely the place to come. We can quickly assess, is the belly pain you're having an appendicitis? So I definitely appreciate that, how we can get all these results quickly.
Yes, that's a very good point. And that's, I think, what happens because a lot of people say, I want to go to the hospital. I don't want to go to the hospital. But they have to if they, want to really be careful. You don't want to have a problem. So anyway, it's been really great having you talk to us, Dr. Ungaro. I really thank you, and I hope nobody comes to the emergency center unless they have to, right?
It was my pleasure. Thank you so much for having me.
Thank you also.
Okay. Bye.